the title of our next panel. How to craft business models that attract investors and fuel growth. We have the speakers ready, so allow me to invite them on the stage right now. We have Michael Treskow, partner at 8 Road Ventures. We have Johannes Blaschke, principal at Calm Storm Ventures. We have Simon Bates, digital health expert, partner at PA Consulting. Enric Claverol, head of the Medical Technologies Program at the European Innovation Council. And the panel discussion moderator, Guy Spigelman, EMEA lead healthcare and life sciences startups, Amazon Web Services. Applause, please, ladies and gentlemen. Panel 10, it's got to be special.
Hold on, is this the last panel of the day? Or?
No.
Oh my goodness, okay.
You're not this lucky guy.
Okay, thank you very much. And thank you all for being here, and thank you to the organizers. I mean, at least from my experience, I think this has been a great day. It's been like one of these conferences that aren't too big and not too small. A lot of great quality content and people, so I've really appreciated it, so thank you very much. So welcome everyone, my name is Guy Spigelman. I lead the healthcare life science practice for startups at Amazon Web Services, and I am joined by 4 incredible panelists. We're all men, unfortunately, up here today, and that should be stated that we need to do something about that. But our task today is really to provide some insight into business models for health tech, how that is going to drive value not just for the companies but also for the investors. But before we get going, let's let our panelists introduce themselves. So, Michael, do you want to take it away?
Sure, thank you. I'm Michael. I'm a partner at 8 Roads Ventures. We're a global VC fund focused on scale-up stage investments in technology companies, and I'm based in London, focused on European investments, and spend a lot of my time on the intersection between healthcare and technology.
Great. Enric?
I'm Enric Claverol. I'm the program manager for medical technologies at the EIC. This is a new vehicle created by the Commission a couple of years ago, the European Innovation Council. And the vehicle was created to support science to market and provide this kind of bridge funding. We have 2 large programs, flagship programs. One is the Accelerator program. Here we invest up to 15 million per project. We always take a minority stake, but it's a matching program, so you have to find co-investors. We also provide a sweetener on top of this 15 million, so we provide 2.5 million non-dilutive. That's the Accelerator. We invest in this program out 1.1 billion per year, but only around 30% goes to medical technologies. And then we have the other program, which is Pathfinder. This is non-dilutive, early stage funding. We provide 4 million per project.
Great. Simon?
So I'm Simon Bates. I'm a partner in PA Consulting, which is a global firm that has offices across the US, Europe, and UK. I focus on digital health, which means we work with investors and investor-backed startups or scale-ups, and with pharma and medtech companies. And we often help them with strategy and business model development, due diligence, but then we'll often stick around and be part of the product roadmap and the go-to-market to help them, get to where they want to get to. So yeah, that's my background.
Thank you. And Johannes?
Hi everyone, I'm Johannes from Calm Storm Ventures. We started out around 3 years ago, have done around 75 investments throughout the last 3 years. Throughout the last 2 years, we've been the most active early stage health tech VC in Europe. We mainly focus on digital health, so when it comes more towards traditional medtech or biotech, it's not our sweet spot, but we rather focus really on the software side of things. Currently, we're investing out of our second fund, for which we are currently still fundraising, probably throughout the next couple of quarters, and have already done around 15 investments this year with this new vehicle. A little bit about my background. Previously worked on the one hand for BCG, did particularly medtech and pharma projects out of Zurich, Switzerland. On the other hand, worked for 2 other VC firms before Calm Storm, one of which is Speed Invest, and the other one is called OSE, Oxford Sciences Enterprises, where we invested in health tech research at university. Thanks for having me.
Thanks, Johannes. You've been busy. 75 investments in 3 years. Wow. All right. I just want to frame our discussion today. And so I think it was back in 2008, I joined my first sort of startup in the healthcare space after being in software. And I was setting up a joint venture for an orthopedic-based intervention for people with knee osteoarthritis in the UK with Bupa. Bupa is the largest private health insurance in the United Kingdom. They're a large healthcare player globally. And I was sitting with the chief medical officer, who was also an emergency room doctor and a McKinsey partner before becoming, so someone very much cleverer than I am. And I was sitting down, we were trying to, it was a very innovative technology. And she said to me, Guy, if when we're thinking about setting up this business in the UK, you really have to understand the 4 Ps of healthcare. And I was like, what are you talking about? 4 Ps of healthcare. So can maybe anyone guess what not you, because we've had a briefing discussion. Anyone in the audience can guess. What are the 4 Ps in healthcare if I'm thinking about business models and... Anyone? Throw out a P in healthcare? The patient. Okay, who said the patient? Right, the patient. That's correct. But, and before, yeah?
Patients, providers, payers.
This guy has done his homework.
I would say that the quote is pharma, but maybe you argue with that.
No, pharma's a great point, and we will get back to it. But exactly sorry, what was your name? Thomas said. Really, the patient is at the center, but if we're thinking about business models, right, we have to understand that there is a provider in healthcare. Now, a provider in healthcare is anyone delivering a healthcare service. It could be a GP or family medicine practice with, one doctor and her assistant, let's say, or it could be a hospital system and everything in between, or a physical therapy clinic or a dental surgery. They are all providers, right? And the other P that was mentioned, besides the patient, is the payer. Who is paying for healthcare? And the 4th P that she said is the pathway between those other 3 Ps. And if you want to build a business model in healthcare, you have to understand that that pathway can be very different depending on which healthcare economy you're actually entering. And there are some healthcare economies, like the United States, that have multiple different models that work simultaneously. I think we had panels before on value-based care, let's say, which is very different from that traditional model where essentially payers and providers are at loggerheads. So just a little bit of framing of our discussion, that when we're talking about business models, we're not just talking about the revenue side, we're also talking about how are you dealing with distribution, how are you dealing with these other elements of healthcare. So I want to just, sort of dive right into it. And one more sort of rule for the road, maybe someone else wants to jump in here. We're talking about health tech. This is I like to be look at the question on the panel is how to craft business models that attract investors and fuel growth, a guide for health tech startups. So what are we talking about when we're talking about health tech, and what aren't we talking about? Does anyone want to jump in?
Yes, I'm happy to jump in. I think today it makes most sense to rather focus on, at least from our perspective, because this is also where we are focusing in, the software part that we call digital health versus the 2 other verticals, which are biotech, so molecule-based solutions, drug development, or on the other hand, traditional medtech, hardware-focused solutions, which of course also would have different implications for the business model.
Okay, I think we can work with that, right? Does everyone agree? So I think we're going to ring fence this and say we're not going to deal with traditional med tech like a stent or a surgical device, right? Or we're not going to deal with a molecule going through the clinic. But let's try and say everything else, that more innovative space that's been put under the term digital health or tech bio, or whatever we're talking about. So maybe the first question I'll have is, are business models for health tech different to existing or prior models for those like medical device or healthcare IT?
Just a quick comment on that. When you look at the portfolio at the EAC, you see all the medtech, stents, that kind of thing, working at different stages completely compared to the health tech as we're defining it today. Most of the health tech based on software, they move very quickly through the development cycle up to the CE marking stage. And they're struggling to get uptake. Whereas most of the medtech stents and implantable devices, they stay doing technology development for years. So that's an interesting thing that you see in our portfolio. It's a completely different situation. One thing I wanted to say about health tech, at least looking at the EAC portfolio, uptake is always so difficult to get, even if you go through the DIGA program and you become part of the list very quickly, we see our projects getting stuck in that the market doesn't know about them. I don't know whether you want to elaborate a bit on that, but this is completely different from the stents kind of domain. No, the stents people spend years doing device development and then CE marking, the clinical validation. We need to invest 5, 7, 10 million just to get started. And sometimes with health tech, we see we can do the clinical validation with 300K. I don't know whether does that ring a bell?
So if I'm paraphrasing what you just said, you have this stent or this new innovative implant. You know, when I was in a VC, we had something like that too called CardiHeal. It was an implant for knee osteoarthritis again. And until the approval, but once they have it, there's a very established business model.
This
right?
is a really good point. Exactly. It takes you years to develop the device, but you can have so much value already. Once you have first in human, I mean, the VCs in general, when we talk to them, they say, look, if the device works and you do first in human, we're in. But in health tech, we see it's a bit different. No, you have to go a long way to prove market uptake. It's completely different. And it's within the medtech umbrella, within EIC. So, yeah, it's really different.
Yeah, I think the thing that marks out health tech is that how and where value is created is just much more complex. So to your point about pathways, you know, those pathways between all those actors in the ecosystem are not linear, right? They are not simple. You don't send some products and services one way and money comes back the other way. And you've got essentially information flowing in a lot of different ways with health tech. So that just makes things so much complicated about where you can create value, and then you've got to measure it, right? And then you've got to be able to say, so how much of that can we capture? So I would say that's one of the things that marks out health tech, and it's much more disruptive. It's a little bit like fintech in the sense that it's not enterprise IT. It's kind of IT, if you like to think of it that way, or software that sits between all these actors is going to make value, create value in different places. But I think from a business case point of view, that's why sometimes it's a bit of an art as well as a science.
Michael, I want to just make some, if you can comment on this too, but maybe let's talk about what types of health tech do you think are gaining more traction these days? Like, what are you seeing in your portfolio or deals that you're looking at that you say, wow, there's actually some success here?
Yeah, for sure. And maybe just to comment on the last point,
sure,
I think
no problem.
you know, from an investor perspective, what we like about digital health models is exactly this lack of binary state that you have a lot of times in molecule or devices, where it's either nothing or it's everything, right? And there's a lot of times there's a third party involved that is a judge of that, be it the FDA or something similar. And we like in digital health this gradual proof points where you can be doing great for your stage. And so when we're partnering with an entrepreneur, we can look at their metrics, whatever they might be, financial or not, and we can say, for where you are, this is impressive, you're making good progress, and there's not this gate that is ahead of them of sort of saying, hey, you've spent a few years working on this, this could go well or not, who knows, right? And I think
a few years can be 10 years as well, you know.
That's right. And from an entrepreneurial perspective, you know, the good news then about having this gradual improvement is that you can also raise more money at a higher valuation as you go along, as opposed to there being these gates, right? And I think, look, what we're seeing today, you know, of course, talking about anything but AI is almost criminal, because that's you know, that's seems to be everything there is. And what's interesting, I think, we're seeing things that are extremely exciting, like curing diseases by using AI, and we're seeing things that are probably on the less exciting but maybe very practical side, like helping doctors save time on taking notes after an appointment, right? So this efficiency gain, right? Mm-hmm. And so it's a funny one where we're kind of jumping back and forth between solving what everyone thinks is the biggest problem in the world and solving problems that are very meaningful but maybe not as flashy, right?
Okay. Johannes, do you want to add, like, where do you see some pathways in health? I'm looking for success. I'm looking for, like, examples. We've got an audience here of startups and maybe other investors. What's working? What business models are working now in health tech?
So today in the morning, I asked a partner of another VC fund here what he would say. What's the business model that attracts VCs? And his answer was, finally one that works.
Okay.
But what we are seeing these days, and obviously you could look at it from a medical specialty standpoint, you could look at it from a technology standpoint. From a technology kind of standpoint, like 100%, currently Gen AI really seems to be the thing. It's not a secret. VCs do follow a herd mentality. And within that, we have seen some good applications, but also a lot of cases where it seems like that founders just sprinkle Gen AI wrappers on top. And I think that doesn't make sense. You can't just say, okay, we do a little bit of AI now, but there's no real use case for it. I think it won't get you to significant investor traction. What we're passionate about is the talent. Like, we see really good people working in the field. I think that is something that is a big advantage. Another area where we see a lot of attention at the moment is this intersection between fintech and health tech. And I think it makes sense historically, right? Because fintech was one of the first big sectors where you had these success breed success cycles of strong VC cases, unicorns, even decacorns, and then the money being reinvested again in the cycle. I think in health tech we are yet to prove that health tech can be such a case, at least in Europe, on a frequent or more ordinary basis. It's a little bit of this approach where you say, if you want to move the mouse, you have to move the cheese. And that's why if you work on something that intersects with fintech, it does seem to get a lot of attraction these days from investors, just because investors understand it historically quite well.
I think you mentioned something about, you mentioned the word Europe, or the place Europe. I mean, I think there's difference in geographies as well, right? But I do want to sort of challenge you back. I mean, what we see, and we obviously work with a lot of the different things, is there's some clear fields that are winners, right? Medical imaging, right? It's doing well. There's people who pay for it. It's adding efficiencies. Digital pathology is starting to actually, and precision medicine. These are digital tools that are changing the medical practice. There's someone to pay for it. It's delivering clinical value. Like, would you agree that these are areas that are stronger, and that perhaps some of the B2C stuff, or even DIGA, I'd love to talk. Does everyone know what DIGA is? The reimbursement scheme in Germany for digital therapeutics. How's that doing? Anyone? How do you think? Do you invest in any DIGAs?
We do. I wanted to make a comment on the imaging.
Sure.
Though. Before I forget. So we have quite a number of companies doing image analysis, and they're doing quite well in general. But one of the things that we observe, in case this might help you guide your submission to us, when they focus on a specific disease, some of them do prostate cancer, breast cancer, lung cancer, counting nodules. It works very well, so technically it works very well. The market likes it, and we've seen some acquisitions already in the space, but they tend to be small acquisitions. Whereas now we're looking more into platforms that can integrate multiple diseases, because then we see the value obviously becoming higher quickly. So that's just one thought about the imaging.
I think that goes to the core of what we talked about before with the providers, because providers don't want to deal with a million different little features. They'd like a platform play, right? And so when you're thinking of business model, think about that side of it as well. Did you have something you wanted to add?
Yeah, so an example I think that maybe brings that to life a little bit, and again, it's in AI for imaging. So a client of ours, their first product didn't end up being the true value prop, right? So what really the hallmark of that success was the flexibility to read the market and pivot the value prop. So for example, we worked with them to change their target customer after a year or two. We said, let's get money from pharma for the next couple of years. That's going to fund us to where we want to be in 6 or 7 years. But we know we can acquire pharma clients for phase 4 trials. That will teach us the market, or get us some presence, and then we'll look at the provider market. And similarly, they didn't start off with a platform, actually. They started with a product, and then the voice of the customer said, well, what if there could be a companion app for the patient for the 6 months between the times they come in to have an MRI? And then that, the synergy of those two things, the medical credibility of the radiologists and neurologists trusting this thing, meant that when they launched a patient companion app, they weren't starting from scratch. So I think the lesson there is be clear on purpose and intent, but be flexible. Read the market through your first couple of years roadmap and really be able to pivot to where the value is.
And the fifth P being pharma, right? So that you mentioned over here. So that pharma is a way to sort of get some funding and some revenues as you're waiting for the regulators and for the providers, which traditionally take a long time. Look, this is going way faster than I expected, but I did want to ask something for the investors here on the panel, and maybe just reflecting the different stages that you invest in. What do you look at? Let's say I'm an early stage health tech, right? I don't yet have revenues. I'm developing something, and I'm coming to you with a pitch deck, and then I've got a slide on the business model. What do you want to see on that slide? Who wants to take that? And then you're more late stage. I'm going to ask you the late stage question in a sec.
I'm happy to take it, but I think I also want to make a first last comment on the DIGA business model.
So sure, yeah, I'd love to.
We've done 75 investments, and a lot of the DIGA obviously is in digital therapeutics. And we, for example, invested in a company on the condition that they will pivot away from DIGA.
Okay.
So I'm not saying that it's bad, but just as a VC case from our perspective, it hasn't been the business model of choice.
And why not?
Just because on the one hand, it takes a lot of time to get there.
Yep.
It's quite expensive. There's a lot of legal work. And when you've got it, you can't scale it across countries quite quickly, which in Europe is a problem, as we know.
Absolutely.
We can talk quite long about the differences between the States, for example, and Europe. But it's really, really tough. So what they ended up doing was they went through payers, but selective contracts. And selective contracts, I think they're a bit more scalable, but it's still really, really tough. It still takes a lot of time. There's still a lot of...
And there's a challenge with distribution, right?
Exactly, and that's the point I wanted to make. I think in this case, you even need to differentiate between what's your business model, so how do you get the money, and what's the distribution model, how do you get to the patients. And in a lot of cases with the selective contracts, the, let's say, conversion on that funnel is not the very best. That's just as a comment on this previous business model, now happy to.
Okay, but what are you looking for in a slide? I'm going to challenge you here. There's some startups here in the audience. What do you want to see on the slide about the business model at an early stage? What's your expectation? And then I'm going to ask for later stage companies.
I mean, at this stage, what we are investing in, it's pre-seed and seed. It's not about the slides. It's not about the numbers. We 99% invest based on the founders. We even call it a founder market fit investment thesis. So we actually mostly look at the founders' loan standing and at the market loan standing, and whether the market is big enough, the founders are really, really excellent and fit well to the market. Sometimes we even say founder problem fit, because the market sometimes is not even there, but they should really be in love with the problem. Okay. On the business model, there still needs to be a track mark. Like, we really want to understand what is it. So the worst mistake that could be made is it's not even on there, or it's just some buzzwords. For example, recently I looked at a company that could have had a business model through out-of-pocket, through providers, through payers, and through pharma, and it was just those 4 buzzwords on there.
So you want to see a more established hypothesis, at least, like some sort of hypothesis of what this could look like.
100%. And then, for example, in a conversation, you would also try to probe and go quite deeply into the thinking, obviously. So the mindset. Into the mindset.
Right, I'm going to cut you off because we only have a couple more minutes. And Michael, I really want to ask you, I'm coming for a Series A or Series, and what do you want to see from me as a startup?
Yeah, and I'll actually answer this a little bit more broadly. I think the short of it is we're looking for simplicity. And so, and the reason I'm saying that is because that is difficult to come by a lot of time in healthcare, right? Okay. And really simply I'm saying, solve a problem, build something people want, but also make sure that the people who want it are also the ones who will pay for it, right? And that's where a lot of times you get into a bit of a dissonance, and where I see some pitches that are attempting to solve the most ambitious problems, where it's very clear that the solution would be valuable, but it's not entirely clear who's going to be paying for it, and how easy it is going to be to get to the point, right? And so, to be concrete, for example, if you're selling something to a pharma company that's going to help them lower the cost, increase their revenue, you have pure alignment of having something that they want, and they're the ones paying it, right? Selling something to a provider can work just as well, right? You have companies that make lives easier of dental clinics, et cetera, right? Selling something to patients can work as well if it's something they really want, right? What people sometimes get trapped up in is sort of saying, we're solving this problem, and everyone agrees it's a problem we're solving, but then you start talking about who uses it, who pays for it, how long is it going to take, what is the timelines, and then it becomes very complicated. It's
jigsaw, right?
And that doesn't mean the problem is not worth solving by any stretch of imagination. Like, I'm not in any way trying to discourage people. I'm saying, as I am looking at these things, what gets us excited are these things where it's all aligned, and then as a result, the numbers are telling a story, right?
Okay. We are out of time. Last thing before
So very quick comment. I mean, to the simplicity point, you can unpack it into 20 plus factors that make a good business case, but it's three things in essence. Is it desirable in the market? Is it viable as a business? And is it feasible as a solution? And that's the kind of clarity I think that investors want.
All right. Well, thank you very much. Please give a round of applause to the panelists. Hope you learned something. Thanks, guys.
A round of applause, much deserved. One question from the audience. We have time for that. If anyone is interested. Yeah. Mike, right behind you.
Hi, I'm Ahuti Rai. I work as an advisor and investor with startups. And one of the dilemmas facing many startups in this space is they see going direct to consumer as a good early option, start bringing in a little bit of revenue, being able to test and get real world data, iterate. But obviously that's often not the scalable model, and certainly many investors are not prepared to back a health tech company that's only D2C. So they also need to start making headway with a B2B model, yet they're early stage, and they also need to remain focused, and running two parallel business models is tough with limited funds and resource. So what would you advise to those startups that are kind of in that space where they see that path, that option, but they know that that's not really their ultimate scalable business model, yet they need to convince you as investors to believe in them?
And a super quick response to this ambitious question.
At the EAC, we're biased towards deep tech. And so if they're working on the core technology that's very unique and has a lot of value, what we typically recommend to our portfolio companies is that they focus on building the value, developing that technology, and that they not get obsessed about getting early sales, because if they don't ramp up, then the value is affected negatively. So we prefer to see the technology being developed very strong, and then to partner with a larger company before trying to get sales.
I'm going to plus one on that. I was in a startup, then we lost $50 million of investors' money trying to go D2C when we should have gone B2B. So yeah, plus one.
It's a tough question for a reason, right? It sounds like you've thought about it. I mean, I would say you kind of have to look at the next stage and what is going to get you the investment if that's your ultimate goal, right? And then typically it means focus on one business model, and moonlight in the evening was the other one, to have just enough proof points to convince someone that if you dedicated more time and resources to that model, that it would bear some fruit, right?
And as I can see, Guy is already preparing for a selfie. Let's give him the opportunity and thank the panelists again, ladies and gentlemen.